Hi, my name is Dr. Allison Bayer, and I'm at the University of Miami at the Diabetes Research Institute. My lab has long been supported by the Diabetes Research Institute Foundation, and we have recently been awarded the Goodman Prize for Young Outstanding Scientist. And this award will really help our lab in moving the research forward with being able to incorporate new technologies, which will allow us to stay at the cutting edge of research. And this will help us move our goal of finding a cure for type 1 diabetes through adaptive Treg therapies so that we can actually impact patients that are currently living with diabetes. We have begun to start transitioning into a new line of investigation, and with the recent American Diabetes Association Basic Science Innovative Award, we will begin these studies this year. So what we found by our previous work is that when we use Treg therapy and an adaptive therapy for looking at autoimmunes, we want to reset the immune response. We found that there's an innate cell called natural killer cells that seems to be getting in the way of Treg cells and inhibiting them in a bad way. So we need to understand these natural killer cells and how there's this interplay between natural killer cells and Treg cells, as well as other T cells, so we can better develop novel therapies to treat type 1 diabetes. So what we have found, NK cells have long thought to be a just single population with a single job. But over the last few years, these natural killer cells have been shown to have many different flavors of natural killer cells. And so we need to understand the inflammatory role and the protective role that they play. And we need to engage the protective role rather than the inflammatory role, because the inflammatory role is what is probably impacting our Treg cells and why in some instances we don't get better therapeutic outcomes. So this grant will really push the field forward in understanding these natural killer cells in the setting of autoimmune diabetes, and specifically how it affects immunotherapies for the treatment of type 1 patients.